nest and breed in the skin folds of your fingers. Every time I even think about scabies, I start itching. The good news is it's very treatable.
Yeah.
Both of them, it's a chemical killing agent. You just get a script. In fact, I think the stuff for lice you can get now without a prescription. You just go over to CVS Pharmacy or Walgreens. Full bed, full bath, full shower, 2 or 3 times. All the linens get washed in hot water with detergent. It's real easy to fix. Okay? Yeah, when I got this second time, I was, yes. Both.
Oh.
Antihistamines, cold compressors, or lukewarm baths with additives. Be cautious with using baths with additives. Yes, really, because my wife has horrible eczema. All right? Doctor said, oh, go take an oatmeal bath. She did. Guess who's allergic to oatmeal?
Oh, shit.
She ended up in the hospital for 4 days.
Oh, no.
All right? There's nothing like having a skin in the hospital. Psoriasis is a scaling disorder. Usually happens, oh, my wife has that too. But it often happens to African American folks. One of your alumni years ago had horrible psoriasis. It is an autoimmune disorder, and it's a skin scaling. He had it on back of both his forearms. It could be 110 outside, and that poor booger was always running around with long sleeve shirts, worse than I did. When we go there. This is what it looks like. Turn the lights down.
So you said about it gets worse in the sun?
Yes. All right.
I don't
Topical
know about that
therapy,
shit.
ultraviolet light can work. They're gonna need some emotional support because this
Hell yeah.
is a body image problem. Okay, lots of folks who have this, they don't wanna show off their skin. This poor student, God bless him. He had it so bad, I could watch him in class. He'd undo his shirt and he'd sit there and scrape like this until I could see blood coming down his arm. There is an old therapy that works on this, but I still profess for it. It's called coal tar therapy. You can get it from an old apothecary pharmacist. You mix it up, you lay it on there, and as it dries, when it peels off, there's healthy pink skin underneath it. Coal tar therapy. Coal tar, C-O-A-L. Go ahead, Nicola. And then there's the types of cancers we can get. This is the one I want you to know about. That's the one that likes to metastasize and cause all kinds of crap. Basal cell cancer is the reason why Miss Howard doesn't run around with her shirt off, showing off her shoulders, because I've got scars right across my shoulders. Because I was a lifeguard in Phoenix.
Oh, God.
Oh.
And this was back in the day when we only had like SPF 3. Now we have SPF, oh my God. Right?
Some of y'all need that dog.
I had to have cancer cut out of my back because of skin cancer. Alright? That's why my wife laughs at me. I go outside to work in the yard. I got a white shirt on and my jeans and my boots. And when she decides she's gonna go out in the yard, I throw her hat at her because she always forgets to wear her hat. She's got skin cancer on her face and on the back of both arms. It's that fine Irish blood. Makes her very susceptible. Northern European women are very susceptible to skin cancer. So how do we do it? Wear a hat! Use your SPF, oh my God. Somebody told me yesterday it was SPF 100.
Mm-hmm. Yep.
I'm like, that's a wool shirt. Right? Doesn't let any sunlight through. All right, this ABCD, drop the F. That's a typo. A, B, C, D, E. You guys know what that is?
Asymmetry, order, color, diameter, and elevation. Pretty good with all of them.
That is how we screen for skin cancer. A, B, C, D, E. There's no F, that's a typo. Okay? So, yeah, I yell at my wife, here's your damn hat. Where's your hat? Where's your hat? You put sunscreen on? No. Go put it on. Alright? And seriously, I'm always wearing a long sleeve shirt. I get the weirdest farmer's tan. You guys know what a farmer's tan is? Farmer's tan is usually short sleeve. If they take off the shirt and everything up is white. No, mine starts right here. I'm serious, about midsummer, my hands will be just nice and bronze, the rest of me, really white. Surgical management, yeah, they'll carve it right out of you. The good news is, most of the time we don't have to use chemo or radiation therapy, we just cut it out. There's also some topical agents now that they use for skin cancer where it's a chemical burn. It creates a chemical peel to peel off the cancerous cells. That's what my wife uses.
Yeah.
There's like 4 different ingredients in it.
Well, they give it to you after you had something cut out, and then.
Yeah. Yeah, she only does one piece of her face at a time, because she has to do it for like a week.
Is it called a Mohs? Will I take like layer by layer?
It's a chemical burn, is the medication. It literally looks like, you know, I put a flare up against the side of her face. Because it'll be all this, she'll do it for a week, she'll take a week off, and then she'll do this. And she'll take a week off, and then she'll do this. Take a week off, and then do this. And for about 4 weeks, her complexion is perfect. She got perfect complexion and no wrinkles, it's amazing.
Well, people pay big money for chemical pills.
I know, and then 6 months down the road, it starts coming back. The blotching comes back, and she has to do it again.
You're right.
Yeah. Any questions over any of that? You guys good? Alright. We're gonna shift to orthopedics real quick, what I got. Actually, no, we're gonna do terminology real quick. That's what I've got. I've got terms. You are not that old. I've heard it on my dad's life. You guys know what I did in my past life? Before I became a nurse? I was a PT. So I took care of orthopedic patients all over the place, musculoskeletal. We're going to talk about different disorders, we're going to talk about complications, and the roles and functions of different groups who take care of these patients. What's the difference between a PT and an OT? Yeah, I know they're 2 different names, but what do?
Physical therapy and occupational therapy.
PT is for mobility.
OT does like the sphasia,
That's
oh,
speech.
sorry.
OT does feeding, dressing, bathing, and meal preparation. Alright? Can you feed yourself? Can you bathe yourself? Can you dress yourself? Can you fix your own food? Alright? Speech pathology is swallowing and talking. Osteoarthritis, total hips, osteoporosis, fractures, amputation, and joint replacement is what we're going to talk about. OA, that's up on the board. I want you to know the difference between OA and RA. OA, osteoarthritis, okay, is a wear and tear disease. This is what makes my joints hurt. Because for 10 years I was a human Hoyer. Pick it up and move it. Alright? It's a degenerative disease of the synovial joints. Breakdown of the cartilage. OA is the most common. 70% of the population have it over the age of 60 in their knees. Why? Because that's our favorite synovial joint to be used. Our knee. My left knee is waiting for a toe to be, I keep telling it no. It can cause functional loss. The good news is, after a joint replacement, and this is a true story, ladies and gentlemen, my left knee will get to the point where I can barely walk on it. And I'm waiting for that pain to stay there, because when it stays there, that's when I'm gonna go get my joint replacement. Because post-surgical pain goes away after a few weeks. Okay? What's RA?
Rheumatoid arthritis.
Rheumatoid arthritis. That's an autoimmune disorder. Alright? OA is a non-inflammatory disease of the synovial joints, whereas RA is inflammation. Okay? I have a friend of mine, Holly is probably old enough to be I know she's old enough to be my mom. She's about this tall, weighs about as much as my left leg. She has had both knees, both hips, both ankles, both wrists, and some of her fingers joints replaced. Because when I met her, she was like this. Wheelchair bound. First time I met her was at a science fiction convention, and she's a very famous author who writes under another name. And because I had a background in PT, somebody introduced her to me, and she caught me off to the side, and she said, "Would you walk up to the ladies room, please?" And I was like, "No problem here." Scooted her in with a wheelchair, chased everybody out, and I said, "Just trust me." Like I said, she weighs about as much as my left leg. I just picked her up, dropped her trowel, put her on the top. I picked up hay bales and weighs more home. RA is very, very painful. Risk factors for primary OA: age, sex, obesity, genetics, daily trauma. That means overuse. Okay? Secondary osteoarthritis. Number one cause is trauma. You can also see it. What's gout?
Buildup of uric acid.
Why? What causes me to get gout in my left big toe?
I get too much protein.
You're close. Too much
Too much
red
salt?
meats,
Salt, red meat, seafood.
organ meats, good, and liquor, red wine. Red wine. That's the reason why Henry VIII had gout. He could eat whatever the hell he wanted because he was king.
None of that shit.
There's no lab specific for OA. Do you guys know the lab for RA? Ooh, somebody look that up. Huh? Look it up. What's the lab associated with RA? I'm tired. I want to address ESR stands for
Elevated urethral.
erythrocyte sed rate. Sed rate. What's the other two?
C-reactive
stands for?
protein level.
C-reactive protein. That was one that was popping up in my head. Why do they look at a CBC for RA? Leukocytes. Good. Good.
But you still see like
joint space because of the loss of cartilage. If you look at my knee x-ray, it's supposed to be like this. Okay, there's a big old chunk of cartilage in between here and here on my right knee. On my left knee, it's down like this. And it's starting to grind bone on bone. That's why it hurts. That's what they're talking about when they're saying bone cysts, the abnormal growth. How do we diagnose it? Number one, joint pain. And then we'll look at radiological findings. The osteophytes are abnormally growing. Stiffness, limited range of motion, deformity, stiffness after inactivity of 30 minutes. Ladies and gentlemen, this is the reason why I pace when I lecture. If I sat on my tush and just read you the PowerPoints, after about 30, 45 minutes, I'd get up and walk like an old woman again. I swear to God, I sound like a bowl of Rice Krispies when I get up in the morning. I go snap, crackle, and pop. I'm not going to beat you on that. I do want you to know about osteoporosis. Osteoporosis versus osteopenia. Osteoporosis versus osteopenia. Osteopenia is the bone remodeling. Osteoporosis is the bone loss. Alright? When I was a PT, we used to have it was like chicken or the egg question. What caused the broken hip? Did the fall cause the fracture? Or did the fracture cause the fall? Because you can get something called a pathological fracture. You're shaking your head. You've heard of that? When?
Well, I've seen x-rays.
Yeah? What happened?
Well, it's just like weakening of the bone.
It just snaps. It just snaps. Osteoporosis and osteopenia happen when the osteoblasts, remember blasts build bone. Did y'all catch that?
Yes.
The blasts build bone. The osteoclasts cannibalize the calcium in the bone. You hear that? Okay? So when I get older and I don't drink my milk or eat my cheese and don't eat my yogurt or take my bone shell calcium supplements with my vitamin D, my body says you don't have enough calcium in your bloodstream to protect your heart. Here, let's go steal some. I know where it's hiding. It's hiding in your bones. Does that make sense? Primary usually happens after menopause. Secondary is usually caused by long-term steroid therapy or hyperparathyroidism. We need to know there's risk factors, the diagnostic testing. We'll do something called the bone scan. And the T-score for osteoporosis is if it's less than -2.5.
That was what score? The D testing?
T-score.
T-score.
It's a bone mineral density score. It's how we diagnose osteoporosis. Every time I see this slide, I want to stand up taller. True story. Back in February, I realized I must be losing some of my height. I took the dogs out to go do their thing first thing in the morning. I started tripping over my old robe. The robe didn't get any longer. I'm wearing the same soft boots I always wear when the weather is bad, but now I'm tripping over my robe. I must be shrinking. Every time I see this slide, I want to stand up nice and tall. What do we call this part right here? Kyphosis, good. Its nickname is Dowager hump. Dowager hump. And the reason why they used to call it a Dowager hump is because the old queens, hello darling, the old queens of Europe would end up with this, and they'd be walking around like this. That was the Dowager Queens. That was their title. So they called it the Dowager hump. So, how do we help? Prevention. Start early. Eat right. Exercise. The best way to prevent osteoporosis is weight-bearing exercise. Weight-bearing exercise. P.S. Bowling is not weight-bearing exercise. Hey, one of the kids argued that with me. I'm like, no, baby, that exercise is your shoulder. Weight-bearing exercise, walking, climbing, jogging, all right? Weight-bearing exercise. Modifiable risk factors. Quit smoking. Eat right. Drug therapy. The drug I want you to know. Alendronate, better known as Fosamax. Fosamax, he is still our favorite drug for this. Yes, you could do calcium and vitamin D supplements. You can do heart therapy or hormonal replacement therapy. But Fosamax will work. It's got some nasty side effects. So he has 3 rules that we have to follow if we're giving Fosamax. You better know these rules. Number 1, take it on an empty belly. You give it first thing in the morning, because I know you're NPO. You usually don't snack while you're, sleeping, right? Number 2, you have to take it with a full glass of water. Because I want it to get through your stomach and into your gut as fast as possible. Number 3, patient must be up for 30 minutes to an hour after they take it. I want them sitting up or 5 hours in bed.
You said 30 minutes to an hour?
30 minutes to an hour right after you take it. The reason is Fosamax will give you the worst GERD of your life. You'll end up with esophageal burns.
Ooh.
You're shaking your head, Terry. What's the matter?
No, I'm just saying,
Know the rules about Fosamax. He's going to come back at you. All right, osteomyelitis. When I was a PT, lots of my patients were diabetics who had had amputations. Lots of them. Because back then, we didn't have 2nd and 3rd generation antibiotics to fight bone infections. Diabetics would get an infection and get into the bone. The number 1 way to fix it was
cut it off.
chop it off. You're going to see it. How many of you guys have seen diabetics losing fingers and toes or feet and legs? Yes? Okay, that's why. They got osteomyelitis. Gets through the skin, gets into the muscle, gets into the bone. It will creep right through your body, go right to your heart. This can kill patients. Okay? Very, very painful. Very, very painful. What are you going to see? Bone pain. Fever, swelling, erythema. You might see a white count go up. Might. All right? First thing they're going to complain about is bone pain, though. How do we fix it? Lots of antibiotics, lots of pain meds, contact precautions, and if we have to, they can even do a bone transplant. If stiff having to yank a chunk out.
Bless you.
All right, let's talk about fractures. Fractures is a break in the bone. Okay? Is a break in the bone. Now, there's a couple of things that happen when we break bone. All right, they can shift and move. Have you guys heard about different types of fractures?
Yes.
Yeah? There's a whole lot of them you need to know.
Daniel, she's a break all day.
Who's here? No? No?
She works in orthopedics.
All right, my grandson is playing on his roller skates. He lands on his elbow the wrong way. He gets a simple or a closed, non-displaced fracture. That means this bone right here has a fracture this way, but the bones are still in alignment. Okay? Non-displaced. All right, it hasn't moved displacement. Displaced, right?
You say
With me?
horizontal?
Yeah. An open compound, what one of my nephews did, on his lower leg. He broke a little skinny bone in his leg, and it went right through the skin.
Did you ever see that?
What?
Basketball player a couple years back, he like fell on his run and his leg came out and his leg was like kind of like dangling.
I done lost my shit. Like,
No, it was a basketball player. Oh.
my nephew did that. I was like, how fast can I get my belt off? All right, bones bleed, plus your muscles bleed. That's gonna be PTSD right back in my neck.
They can break it.
He fell during the game.
No, your nephew.
Huh? Oh, he was just horsing around.
Oh.
He was being a kid. He was a kid. He was like this big.
Kevin Walsh.
A commuted fracture is fragmented. That'd be like somebody hitting my arm with a baseball bat. And so now you've just got bone fragments in there. Okay? A displaced fracture, can you guys see the difference between this one and this one? This one is displaced. It's not in alignment anymore. An oblique fracture is it comes down this way. That's usually a trauma. The one that really pisses me off the most is a spiral fracture.
Abuse.
If you see, and I mean this, I want you to eyes on me because I want to make sure you all get this. If you see or hear about a spiral fracture
Domestics.
on a child or frail elderly, the first thing I want you to do is suspect abuse. A spiral fracture usually happens when somebody grabs and twists and yanks. That's what causes the bone to spin and break. So a child or frail elderly. Your job is to safety. Separate that patient from whoever's with him. I'm sorry, but we're going to have to ask you to wait there, because I'm just going to take him down to X-ray, okay? Lie like a rook. Do not play poker with nurses. We lie really well. Okay? We will separate them. Get that person away from whoever's with them. An impacted fracture, usually we see this as a compression fracture in the spine. This is grandma who landed on her butt hard. Okay? And a green stick fracture, unfortunately, we see that one in children, and it likes to affect the growth plate. That bone slows down on its growth progression. I'm not going to get you on stage right here. I do want you to know about treatment.
Question.
Yes, dear.
So what would you do to, help?
It is really, really cool. They'll take bones, healthy bone cells from another part of the body, implant them, and then they give it electricity. I'm serious, this is like Star Trek stuff, it's voodoo shit. And it will help the bones reknit. Now, I have seen patients who've had great stick fractures, where it affects the growth plate, and they will purposely go in, break it again, and start stretching it and letting it grow. Yes?
So I got cracked. I had it compacted and then like the fragmented, like on both bones. And I had like a metal rod, like where they had like the fragments from.
They had to
And
put
then
it back
they
together,
fused, like, I don't have joints, like they fused my hand.
your whole wrist.
Yeah, cause they just took it out. He was like, it's too much to like get it all back together, like with the fragments.
Yeah. It depends on how smashed up it is. All right. A closed reduction is when you are putting things back, okay, we're displaced. You guys with me? You give the patient a whole lot of good pain meds, and then you have to realign it. That's a closed reduction. We can do that without breaking the skin. They just realign it and then cast it up. Okay? We'll put casts or we'll put splints on. What do you guys know about the rules about casts? Don't get them wet. What else do I not do?
Don't be sticking stuff in there.
Don't be sticking nothing in here. You imagine me wearing a cast on my forearm. Nothing goes in here except for one thing. Cool air from a hairdryer. Okay? I've seen people take coat hangers and pens and rulers. What's gonna happen inside that cast if I scrape my skin and bleed?
An infection.
Don't do it. Now, a fresh cast, we have to do what's called a neurovascular check on that extremity, either the hand or the legs, because I'm worried about something called compartment syndrome. And to do a neurovascular check, I'm looking for the 6 P's. It's on the board. The 6 P's for a neurovascular assessment. The first one is really fun to try and say. It's picolothermia.
Piccolo.
It means cool to the touch. Picolothermia, cool to the touch. What is paresthesia? Paresthesia.
Not
I
moving?
can't feel it.
Oh.
I can't feel it. My fingers went numb. What's
Oh,
paralysis?
that's the one.
Can't move it. Now, pallor is color, turning the wrong color. It's either turned white or blue. Pain, I hope you all know what pain is. And then pulselessness. There's no distal pulse. If somebody is popping positive on those 6 P's, and it doesn't have to be all 6, okay? That means that cast is on too tight. They're gonna end up with compartment syndrome. Do you guys remember where your fascia is? It's that layer inside that wraps around all of our muscles. Your fascia. If they end up with compartment syndrome, they need to be seen immediately. That cast has to come off. Worst case scenario, the doctor may have to do what's called a fasciotomy, which is really rude because I've taken the cast off and now I've just sliced you wide open to relieve all that pressure. Is that going to put the patient at very high risk for an infection? Absolutely. Worst case scenario, they could lose that limb. Okay? So we have to assess after a fresh cast. Now, another surgery they can do, and I'm gonna be drawing on the board, because that's the only way I know to teach it, is called an ORIF. You ever heard of that? Yes, no, maybe? Yeah. Back up. Okay. They're gonna put a bar here, and a bar here, and a whole mess of pins pinning me back together. Okay? But before they get me to the OR, because this is not emergency, believe it or not, they'll let a patient wait a day or two if they have to, just to let the swelling go down. They'll put them in what's called, there's two types of traction I want you to know about. The first one is called skin traction, because it's outside the skin. They'll put this funky little boot on me. And it's pulling on my leg. Okay? It's got a little rope attached to it. It goes to a pulley hanging off the bed. And this is like a 5 or 10 pound weight.
Is it stretching it?
It's gently pulling. Alright? That'll help with the muscle spasm and help the swelling go down. The rules about the traction: don't let this weight sit on the floor. And don't let the little germ factories play with it. I've seen kids messing with those and I'm like, stop it. The second kind of traction you need to know about is called skeletal traction. And it is exactly what you think it is. Those, yep, that's the picture of it. Those pins go right into the bone. That is an external fixator. That is bone traction, skeletal traction. Your job as a registered nurse is to do pin care. Those pins are a superhighway going straight to the bone. Do you think it's kind of important that we make sure that those points, go ahead and hit the lights for a second, please. Those points where it's going in have to be kept clean. Your job is to do pin care. So you're making sure there's no, increased redness. It's gonna be red.
Ooh,
But no increased redness, no oozing drainage,
that shit look painful.
no increased pain. All right?
Any of us have things specific.
I love to clean it with half hydrogen peroxide, half saline, and sterile Q-tips. Okay? That's an external fixator.
So the other one is it like just connects to the cast?
That one's just a soft foamy boot that hangs onto your leg. That's what that lower part is.
Which fixation devices aren't hooked up to the bed?
That aren't hooked up to the bed?
Yeah.
You can have one of these that's not on, yeah, I've seen one of these. Poor dude wrecked his motorcycle, fractured his pelvis. Fractured his pelvis, and so he had one of these hanging out of him like this, so he could walk, to hold his pelvis in place. And I used to beat him with a stick, because guess what he did at lunchtime? He put his tray right here. I'm like, okay. Go ahead and hit the lights. An external fixator without the traction is called a Hoffman device, but I'm not gonna drill you on it. It's called the Hoffman device, Dr. Hoffman invented it.
And it looks just like
Is
that,
it-
but not trapezius.
You guys did a UTI case study?
Alright, complications of the fractures, they can get a venous emboli infection. How am I gonna end up with hypovolemic shock if I had one of those fractures? Bleeding,
I was gonna say, believe me.
bleeding. Bones bleed. Alright, you can also throw a fat emboli because there's bone marrow has fat in it. Compartment syndrome, crush syndrome, rhabdo. Rhabdo, ooh. Rhabdo. That's risk. All, what do my notes say about rhabdo? Did y'all catch that? You get rhabdo will cause kidney failure from a crush injury. The myoglobin from the crush injury is spilled into the bloodstream. It pisses off your kidneys. You can actually go into kidney failure from this. Alright? I've also seen rhabdo from a weightlifter. You're shaking your head. You know how?
I've seen the labs for weightlifters and the black urine and.
I had a guy who was getting ready to do a show. This was way before some people were born. He was getting ready to do a show. And he was a bodyweight, right? And so he is like not drinking water because he wants to be cut, right? And he is powerlifting, and now his arm's locked up. His girlfriend had to help him pee. And when he started peeing, he was peeing the color of my shirt. So he got to go into the hospital and stay there. He missed the show.
I was gonna say, he didn't win?
No. He missed the show because he was there for a week.
His arms stayed like that?
His arms locked. He had so much lactic acid built up and so many micro tears, he spilled so much myoglobin into his bloodstream, he was putting himself into kidney failure. I said, you know what, honey? You're gonna have to give up bodybuilding when we put an AV fistula in your arm for your dialysis if you don't start drinking water when you're training. And he was like, what? And this is way before internet, way before magic phone. So I pulled out an old medical book and showed him what an AV fistula was like. And his answer was, I'd rather be dead. I said, well, keep doing what you're doing. You'll be dead in about a year.
What's that?
Doctor looked at me and said, yeah, I am.
Yeah, I am.
All right, so one of the things I want to talk to you about, yes.
My brother's actually a bodybuilder and he's only done some